Hello, I'm Kareem Harbin. I'm the Associate Director here at Crossroads. Here at Crossroads, we house up to 45 clients daily, and we provide community service support to clients through groups.
So we act as either like a step down from a higher level of care for clients, so that might be the hospital, it might be a crisis program, and we also act as like a prevention for clients who are maybe in the community already, living in a boarding care or living with family and they're struggling. And so, and maybe they're on the track to possibly go to the hospital, but if they can come here first and we can provide more support, we can prevent that. About 98% of our population have some form of schizophrenia or bipolar disorder, with the other 2% maybe it being somewhere around like major depression or anxiety disorder, but generally everybody has some sort of schizophrenia or bipolar disorder. One of the things that I compare our program to is almost like a college dorm. The houses are kind of set up like dorms. Clients wake up, they'll take their meds, eat breakfast, and then we have groups, but it's kind of like classes. And so clients are in group generally from like 9 to 2. Depending on the day, the times might be slightly different. And then after that, it's kind of like their free time. So the rest of their day, before COVID, clients might go out, visit family, they might have visitors here. Sometimes in the evenings, we will have different activities. We might have like a movie night, there might be an art group. But it's a lot like being in college in my opinion. So at Crossroads, we have a really integrated program. So we have nurses on staff that can support clients with learning their medications, but also checking in with them about side effects and also checking in with them about medical conditions. A large part of our population has some form of diabetes, hypertension, high cholesterol, that often is one of the side effects of the medications they take. And so it's really important that we support clients with managing those to the best of their ability. So our nurses are really able to engage clients around that. Additionally, we have a partnership with a medical clinic that comes on site twice a week, which has really been great for clients to be able, for one, to get needs addressed immediately. And also, a lot of our clients have active symptoms. And so in the past, as a case manager, when I had taken clients to like appointments in the community, one of the challenges was like being in the waiting room, right? Like you're in the waiting room, there's other people, there might be kids screaming, there might be all of these things happening. And for a lot of our clients, that's extremely anxiety provoking. Or they might hear voices louder, or they might be struggling to respond to voices louder. So having a clinic on site has been essential to just really eliminate that. Clients can be in group, we can pull them in group, and they can go straight to the doctor, which has been great. Additionally, by kind of having this medical support here, then clients can learn how to advocate for themselves, learn how to ask appropriate questions, learn how to just talk with the doctor. For most of us, oftentimes we forget the things we want to ask the doctor when we go, right? Like there's a certain power differential. And so supporting clients with being comfortable and having some of these conversations with their doctors is essential for when they leave here so that they can continue to manage whatever medical needs that they have.
One of the main things we want to have here is have this feel like a warm environment. We don't want this to feel like hospital, cold, bare walls. We want there to be art, we want there to be plant life, we want this to feel like people feeling safe and secure here. And one of the things is having clients' artwork. So you can see we have welcome in a variety of languages here, and people's self-portraits and the masks of themselves as well. Throughout the whole facility, you'll see clients' artwork everywhere. And we want people to feel not only comfortable here, but feel that they are contributing to their space. So they are participating and allowing this to be a safe environment for everyone. Okay, so this is my favorite room. This is the art room. As you can see, we have these huge murals. This is directed by staff, but done by clients. This whole space wall that we have here was done by a client who never did any artwork before coming to this facility. And first was hesitant to even draw a small picture or paint something this small because of that anxiety and performance and feeling like they're not an artist. Ended up being a coping skill that she ended up using consistently for the next year or so, and even is continuing to do that now in her independent living space. What we do is we try to have as many mediums as possible to allow for a variety of outlets and for people to have, experiencing success and, feeling like they can be creative folks. And this is a place where there's no judgment. One of the best things about art, if you're working on something, you're painting, you're drawing on something, you don't like it, you can just toss it and start again or paint over it. This is really a place for people to be compassionate towards themselves and just be present. Okay, so we have 4 dorms here, A, B, C, and D. A is all female, B is male and female, and C and D are all males. That does change depending on the population, but that's about where it stays. So we're going inside the A dorm now. So in between each of the dorms, there's a bridge office where we have bridge staff, and we also have the nursing office. This is where they get their medication support. And here's where where the laundry is as well. This is the common area. Every dorm is about the same in terms of the common area. And there's also computers and phones that they can use as well. Payphone and also phones inside the bridge office if they need some staff support. Since we have a very intensive program, there's a lot of obligations. We want people to have a structured day program, and the purpose of that is, not only skill building and symptom management, it's also having yourself obligated to a thing to have that level of accountability. So it's really a holistic approach to treatment. So here's just kind of a layout of this week's groups. And they are a bit more minimal because of the COVID crisis. So things are always in flux, but we just roll with it because that's what we do. This is not just a gym, it is our occupational therapy room. So we are fortunate to have an occupational therapist, Ivy Rodriguez, who runs OT groups here. For those who are not too familiar with the OT process, it's really about functional capacity, right? So we have some people who are walkers, have had strokes, injuries, and so on and so forth. So it's not just about getting beach muscles, it's about functional capacity.
Hi, I'm Glenn Jacob Oviatt. I'm one of the clinicians here at Crossroads, and we're in the Serenity Garden that we've started to work on in the last year and a half. And so the clients have been working on keeping the space clean. We can have different groups out here, like meditation groups, art groups, writing groups. And so we're just kind of working on keeping it clean and spruced up, organizing for plants. We actually have a vegetable garden over here around the corner where clients can learn to grow and sow their own vegetables. And then once they harvest them, we actually take them into a cooking group and we teach them different skills in the kitchen. So it's a lot of fun, and we try to incorporate a lot of different things with multiple groups. So we're hoping to expand it more, and the clients are very excited about it in the future.
So we really try to have as many activities as possible. Obviously those change depending on what the world is like at the moment, but ping pong is a really good activity. We also not only kind of encourage people to kind of socialize with each other, but we want to have us all be on the same playing field. So we'll have tournaments with like residents and staff. We have the ping pong table here, we have basketball court outside. We also have volleyball nets, wiffle ball, different activities. We really want to make sure that managing physical health and do fun activities with their peers.
The majority of our program is funded through Medi-Cal. Medi-Cal does not pay for gardening. They don't necessarily pay for art expression. And so that stuff has come a lot from donors, from grants. One of the things the clients do, and we do as a facility actually, is recycle. And so we have been able to get quite a decent amount of funds from recycling, like once a month. They will usually take stuff to the recycling thing right down the street, so the clients will take it down there, get the money, and then we can use that for things like tie-dyeing shirts or buying more garden supplies as well if we don't have additional funding.
All of the services at Crossroads Village, as well as all the services across Momentum for Health, are provided through support of our donors and friends. And we just want to take a minute to say thank you very much for all that support. It's so important, especially during the pandemic. And I just want to say again that once things are back to normal, we'd love to be able to do this and have this tour for you in person. And we look forward to that day. Until then, thank you from all the clients and all the staff of Momentum for Health for all of your support.